Whelan Presley and Van Ho Funeral Homes have been serving Quad City families and veterans for over 100 years. Whelan Presley is located in Rock Island, Milan, Reynolds, and Van Ho in East Moline, proudly supporting WQPT. Alternatives is a proud supporter of WQPT and has been serving our community for 40 years. Alternatives provides professional guidance to maintain independence and quality of life for older adults and adults with disabilities.
Back to school time is also a time when we look at vaccines and immunizations, not only for our children, but for ourselves in the cities. School is back in session, and that means children need to be up to date on their immunizations. But the approaching winter months is also a time we're all thinking about vaccines. The Rock Island County Health Department is making the push for all of us to be up to date with our shots. But the department has also been at the forefront of making our firearms safer around our children as well. We talked with the interim administrator of the health department, Janet Hill. So we're heading into a new school year, and children's immunizations are required.
Right.
How tough is it to get a lot of these families to have their kids immunized? Because there is that fear of shots, of course, but there's also kind of a groundswell against it.
So luckily, most of our families, a clear majority, about 90%, get all of the vaccinations that are necessary before the child enters kindergarten. However, we are seeing a really alarming decrease in that. And, and especially with measles, mumps, and rubella, that is, measles are highly contagious. And so not having 95% of the population vaccinated is a real dangerous situation when kids go into school. And it's really dangerous for infants because you don't get your first shot until you're 1. So every time someone decides not to vaccinate their child, they are putting every infant at risk.
Well, and you're also always fearful because of those that have
compromised.
Yeah, thank you very much. I couldn't remember. But I mean, and people who might be cancer patients, anybody who is in a much more delicate health situation, that's got to be part of the scare.
It is. I mean, all of these viruses are circulating all the time. And if you are not vaccinated, you are susceptible to them.
Is it also kind of a fear that in some cases, some of these diseases, some of these viruses we thought were going to be wiped out, even polio, and still we're seeing in some areas, not widespread, but
Right.
little times where it is percolating back up?
That's right. So there are 14 vaccine preventable diseases, and almost all of them are done before age 2. And then you have to have some boosters, and then you need through 18 or some additional doses. And then there's some adult vaccinations also. But it's really important to get those done before your child starts kindergarten, because that's when they're going to be in school and around other children.
So what is the lesson here? Because like you said, the vast majority of people do have their children immunized. There are people who are just dead set against it. Mm-hmm. They're not. That's not something that you're probably going to be able to change, is it?
I just think through education. It's been so long since some of these diseases have been prevalent. I mean, you talk to your grandparents and they can tell you about how horrible measles was or how they knew a kid who died from mumps. But because we haven't had these diseases very prominently, people forget about them. I have a brochure at the office that shows what polio looks like, what mumps looks like. And when I have a parent who is hesitant, I show them that brochure because they just don't know. They've never seen it. And so they think if they haven't seen it, it doesn't exist. But they're around and they will pop up if you're not taking the proper precautions.
But is some of this also COVID related? I mean, you always go back to COVID, I guess.
Right.
Is that people don't want the shots or people just didn't believe in the vaccine? Does that kind of perpetuate itself right now as far as other shots are concerned?
I think that is absolutely true. We are at a time where people don't believe in facts, and that is really concerning. I mean, science is science. And, while we were learning about COVID, we were learning as we went along. And I think that some people didn't understand the scientific process and didn't understand that something that was said a few months ago might not be true now because the virus was evolving. We've never really experienced that in real time. So I just think that people need to understand that there's hundreds of years of vaccinations, and they are safe, they are effective, and they keep our population as a whole healthy.
Well, let's talk about this fall then, because once again, we got the flu shots that are coming. And also by late September, we're expecting the COVID shots to be available. Is that correct?
That's right.
We're also seeing some increases in some areas of COVID popping up again. And I think I don't think, you know this as well as I do, is that there's people who are going to say, well, of course these numbers are being cooked up because now is the time they want you to get the shot. How important is the transparency that you have and the information to actually explain to people why these shots are important?
I think transparency is always important when you're dealing with the public. And we are starting to see a little bit of an increase in COVID, and we're seeing that through a wastewater surveillance system.
That's what I was going to get at. And is that tested in the Quad Cities?
It is. There are 2 spots in Moline, and they watch flu, RSV, and COVID. And in June, when there was a rash of RSV, we saw that in the wastewater before it actually hit the doctor's offices, and we're starting to see more cases pop up after seeing the early data in the wastewater.
It's really interesting that is where you go to get this information is through the wastewater system, but it does kind of make sense because it's community-wide.
That's right, and the virus sheds, or any virus sheds sometimes before symptoms, and it sheds into the wastewater system. So, we're really happy that the city of Moline is participating in this. It gives us a really good snapshot here in the Quad Cities.
And with the latest test, what have you seen?
We've seen more COVID. And so we fully expect that there will be more cases this fall. The good news is that most people, it's going to be a mild case. The booster, we don't have all of the details yet from the CDC. There's been some talk that it will be recommended for anyone who feels that it's necessary for them, but especially targeting the older folks and the immunocompromised. We have a high level of immunity right now, and that's really good.
When you say older folks?
50 and older.
50 and older. What about RSV? Because once again, that's the elderly, but it's also the very young.
That's right. So there is a new vaccine for older people and pregnant persons. There's not a vaccine for babies, but there are treatments available. So if you're an older person, a grandparent being around a baby, it would be a really good idea to talk to your medical provider about getting an RSV vaccine.
RSV, of course, is respiratory syncytial.
If you say so.
Virus? Yeah, I've got it. I wanted to write it out just to test me, and of course I didn't do so well. The RSV vaccine has been very effective, but let's be honest, we saw a bad rash of RSV among our children, last fall? Last fall, and
there was another one in June. And it is very, very scary. Babies turn blue, and throughout the winter season, if a child is hospitalized, it most likely is RSV. That's how serious it is.
And can you make any prediction? Are we expecting a tough winter?
We are expecting a tough winter with all respiratory viruses.
Really?
Because our behaviors have completely changed now since the pandemic. We were taking a little bit more precautions than we are now. There'll be very few people masking. Masking is still always an option for someone if they don't feel well or want to offer themselves and others extra protection. How we gauge it is on the Southern Hemisphere, and many countries in the Southern Hemisphere have had a really bad flu season.
And so that just migrates.
Right.
The other thing is that when we had COVID, of course, people were very good at washing their hands or keeping their distance, or if they're feeling ill, perhaps staying home, or as you said, the masking. I don't want to say you miss those days, but you must miss those preventative measures that people were taking.
That's right. Soap and water kills a lot of virus. And so taking just proper hand hygiene, covering your cough, staying home when you're sick, those are tried and true infection prevention efforts, whether it's RSV, the common cold, COVID, the flu. Just knowing your body and taking care of it to take care of your community is the best way to go.
On a completely different matter, Rock Island County Health Department was offering free gun locks, gun safety locks, and well, I don't want to say sold out because they were free, but they were gone.
They were.
First off, what does that mean for the program? And second off, I know you got more locks that came in.
We do have more locks, and we have more coming. We were very happily surprised of how many people took advantage of this.
What? Yeah. I mean, why do you think that happened?
I think that people understand that it's personal responsibility if you are a gun owner to make sure that it's a properly secured and safe weapon. We know that 4.6 million children across the country live in homes with loaded and unsecured guns. That's just tragedy waiting to happen. So securing these guns will make curious children not be able to play with a gun. And then plus, if you have a gun in the home that's unsecured, there's a higher risk of suicide. And we know that in the Quad Cities, about 53 people each year commit suicide, and many of them are through firearms.
It also, because it surprised me that you sold out, or they were given out so quickly. That also underlines the need for it, that actually gun owners believe there's a need for it. That's what I found surprising.
We were thrilled. We were very happily surprised. We ordered a minimum number, and then almost immediately ordered more. And so we are happily giving them out to whoever wants it. We're not asking any questions. An Iowa resident, a different county resident, it doesn't matter, we'll give them to you.
And is it for all different types of guns? I mean, explain to me the program.
So it is for, I'm not a gun expert, but it is for many different types of guns. And they look like bicycle locks. And they just kind of go through where the bullet would go, and then you lock it up, and then it's a key, it's not a combination. So we recommend keeping the key in a different location from the gun,
Sure.
So the child can't figure out how to get it open. And also, when the lock goes through, you can't have a bullet. So that's a second level of protection.
Yeah.
Right.
Tell me a little bit also, because we were talking about, as you said, youth, and when you think of the gun locks, that's part of it. The state of Illinois is also mandating extra mental health services in the schools. Mm-hmm. And we got through COVID, but the kids were scarred perhaps in ways that we won't understand for years.
That's right.
How important is the mental health aspect right now for society? Because it seems like we were very fragile as a nation and as a community, and I'm not exactly sure if we're not still.
I think we still are, especially our kids. I can tell you that my husband is a mental health therapist who specializes in adolescents, and every year of his 20-year career, his caseload has grown. The kids are not okay, and so we are thrilled that the state of Illinois is recognizing that we need more school-based services. And there's a grant that's available for these schools. The deadline is September 8th, and we really hope our local school districts apply for it.
Because you are seeing the need.
We are seeing the need.
And kids of all ages, too.
That's right. And we're seeing it past the adolescent years also. You know, we're seeing some of our moms come in for depression screenings, you know, when they're pregnant and after birth. You know, we're seeing higher rates of depression. So we know that it may start with children, but it does not end there.
You brought up once again women, children. The WIC program is so critically important. Congress is going to be reconvening in September, of course. One of the areas that they're looking at is the Farm Bill and perhaps cutting out a WIC. Perhaps as many as 750,000 people could be taken off of WIC if a Republican plan passes. I know that you're a strong believer that WIC works, and instead of cutting, it should be expanded.
Absolutely. Right now, we have the ability to give pregnant women and postpartum women and children extra fruits and vegetables, and we know that they are using every dime of those fresh fruits and vegetables, or frozen, or some canned also. We know that this is a really effective way to make sure that our children are getting the proper nutrition that they need. WIC is not an entitlement program. It is nutrition, education, and supplemental food. So cutting WIC really will impact not only our patients, but it also will affect the economic development in each community. WIC is a big driver of economic development at the grocery store level.
Well, and it's also a little worrisome because it's so important to make sure that the children are very young are able to be nutritionally, helped and aided. And if they're not, learning decreases.
That's right.
Societal issues increase, and as you said, medical issues as well.
Right, and WIC is not just, like I said, not just supplemental food. It teaches people how to be good parents. You don't just give birth and suddenly know how to feed an infant. We are breastfeeding experts. We are some of the leading breastfeeding experts in this community. We are strongly advocate for breastfeeding, and we know that that's the best way for an infant to get its nutritional needs. But if a mother or a family chooses not to do that, we're there to talk about the best ways to make sure that the child gets the nutrition it needs.
And you have an interesting program that targets Black women in particular and breastfeeding, because the statistics show that more Black women are not necessarily breastfeeding, and that is also having an impact on society as well.
That's right. Black mothers are about 2.5% less likely to breastfeed than white mothers. And that's due to a number of factors, structural and institutionalized racism at the top of the list. But it also is businesses not allowing time for mothers or pregnant or formerly pregnant people to express milk. Is Illinois law that they must be given sufficient breast time or break time to breast pump. And sometimes, if you are in a professional job, you close your office door and you can take care of it. If you are working at McDonald's or another service industry job, there is not an easy way to do that. So we need employers to understand that this is how we grow healthy communities at the very beginning, as we give parents the time they need to be parents.
In so many ways, that's one of the areas of concern for the health departments, county by county in Illinois, is to make sure that young mothers and women get the medical treatment that they need. And during the worst of the years, when Illinois saw those 2 years of budget freezes and we weren't quite sure what was going to happen, one of the areas that was especially hit was the public health departments. And one of the areas you guys had to do was allocate where the money was going to go that you did have. And some of the programs that had to be cut or diminished involved women's health. Have those monies been restored? Are your programs for breast cancer, for breast care, for like the WIC programs, the mother and infant programs, have those been restored to the levels?
Not yet. We have seen a little bit more funding post-pandemic, but it's a 5-year commitment, and it's $6 million all across the state. So when you factor in that there are about 100 health departments across the state, it's not a ton of money per health department. Over the past 15 years, we've lost half of our staff. We closed an entire program dedicated to women's reproductive health. And thankfully, the Henry County Health Department comes to our clinic twice a month to offer those services. We do a lot of referring to our other partners, such as community health care. However, we know that the health department is looked at as a place where people can go get help. And we would love to be able to offer those programs to our clients directly, but the funding is just not there.
We've talked a lot about immunizations and public health issues. What is the number one public health issue that you see right now for Rock Island County?
I would say it's public trust. We did not handle the pandemic as well as we could have as a country, and that was from the very top and all the way down to the local level. I think that there was one good thing about the pandemic is that people saw what the health department did, but immunizations is just one part of our goal. We're here to serve our residents in all eras of their health life, and we just want people to understand that we're here to help and that we are need to be fully funded to do that.
And building back that public trust is not easy. I mean, how, other than, like you said, information, getting out there, talking to me even,
right?
Other than those things, what else can you do? How do you reach the people that still are suspicious?
I'd say that we just are there consistently. We make them understand that we are here to prevent disease, promote health, and protect our residents. And that is what we do. That is our mission. That's what we do every single day, not just during a pandemic. It is a reason why we exist.
There's one other area that I wanted to ask you about, and that is because we're coming towards the end of summer and the beginning of fall, and this is actually the period where we start hearing a little bit more about West Nile. Right. We do have a case in, I think, Cook County where a person did die. I know Rock Island County continues to trap mosquitoes. Right. They've got that surveillance program that is ongoing. Is West Nile really one of those issues that gets a lot of headlines, but it really isn't that big of a concern?
It is a concern. Any virus is a concern, and it does affect people who are older or immunocompromised. So if you have some health issues, you should absolutely protect yourself against West Nile by wearing repellent, not going out at dawn and dusk, wearing long sleeves. You also can help us by, if you see a bird that's dead in your yard that is obviously not by trauma, to give us a call, or if you see standing water. It's kind of up to all of us to prevent West Nile to circulate in our community. And like I said, with most viruses, healthy people, they'll slough it off. They'll maybe not feel well for a couple of days, but it can kill people, and it did in Cook County.
Yeah, and we also talked about the pandemic and its impact on people, but it's, as you mentioned, it's had a huge impact on your staff and on the nursing community as well.
That's right.
Is that, the stress that everybody endured in your office, have we moved on from that, or are there still residuals? I
think there are still residuals. Our staff and our partners in the healthcare delivery system, we were wrung out, and we haven't been able to grow our staff at this point. We would really like to do that. We are going to be seeking additional funding in the coming years. But it was a really tough time, and people are tired. And so that's why I think it's really important that we just continue to go out and tell people why we exist and why we're so very important. We don't do a good job of funding things that we can't see in this society. And with public health, you don't see what we do unless something horrible like a global pandemic happens.
Our thanks to Janet Hill, Interim Administrator of the Rock Island County Health Department. Well, classes are back in session, so the summer is over for many of us. Laura Adams knows that also means a transition in the events calendar for our area. So here's Laura with some great ideas for September as we look to go out and about.
This is Out and About for September 1st through 8th. It's coming up on Labor Day weekend, and loads of early fall activities, starting with the teepee gathering on the shores of the Mississippi River at the Illinowick State Park. It's also time for the Extreme Rock Island Grand Prix, the world's largest professional go-karting street race in downtown Rock Island, the 2nd and 3rd. The Walnut Grove Pioneer Village is holding their Fall Festival on the 3rd and 4th in Long Grove, Iowa, while Eagle Ridge Resort celebrates Labor Day weekend with all kinds of exciting activities in the Galena Territory. Plus, enjoy the Milan Harvest Festival through the 4th at Camden Park in Milan. On stage, catch Escape to Margaritaville at Circa 21 through September 9th. Or enjoy coffee and hear Americana melodies at Dead Poets Espresso on the 2nd. Playcrafters Barn Theater in Moline present the Agatha Christie mystery Witness for the Prosecution, September 1st through 4th. Plus, there's music at the Railroad Park Gazebo in Silvis on the 6th, and Thursday Night Groove at Schwiebert Park on the 7th. If you have an upcoming event, be sure to list it at visitquadcities.com. For more information, visit wqpt.org.
Thank you, Laura. Jenny Lynn Stacy joined us at Moline's Black Box Theater to perform one of her originals. So here's Jenny Lynn Stacy with I Prefer It.
Hello was my name. My heart was much the same. Thankfully, my mind sorted it out in time for a better day. The pause between the takes prefer it this way. And I must be excused. My mind's going to lose it. Regretfully, I have gone off the trail in time for a better day. In time for a better day. When you found me, I was feeling cold. What could you do to me? Hell, I do not know. But I love you. I say it all the time, and I prefer it this way. Don't you need me? Is this all way too fast? I'm not the easiest to love. Hell, I do know that. But I dig you. I say it all the time, and I prefer it this way. Oh, I prefer it this way. Oh, I prefer it this way.
Jenny Lynn Stacy with I Prefer It, performed at the Black Box Theater in downtown Moline. On the air, on the radio, on the web, on your mobile device, and streaming on your computer, thanks for taking some time to join us as we talk about the issues on the cities.
Whelan Presley and Van Ho Funeral Homes have been serving Quad City families and veterans for over 100 years. Whelan Presley is located in Rock Island, Milan, Reynolds, and Van Ho in East Moline, proudly supporting WQPT. Alternatives is a proud supporter of WQPT and has been serving our community for 40 years. Alternatives provides professional guidance to maintain independence and quality of life for older adults and adults with disabilities.